Hi everyone, it's Carrie. Just doing an update on my lung reduction surgery. It's been probably close to 2 years now since I had my surgery done, and I get a lot of emails from people wanting to know more about what I went through at the hospital. Um, I don't really even remember what I put in my first and second videos, but I just wanted to highlight some of the things that people have been asking me about how my surgery went. And I just want you to know that I would think everyone's surgery might be different, so I don't want to give preconceived ideas of how it might go for you. My surgery was on my upper lobes of my lung. Both of them were done at the same time. It was not very invasive surgery. It's like 4 small inch-size slats on both sides, where they put these tubes in there. I mean, obviously they go in there and cut out the lung, the bad stuff. And I think I was told they took 20 or 30% of both sides of my lungs. And so when you come out of surgery, people are like, well, were you in pain? Yes. I mean, I wasn't. I come out and I kind of panicked a little bit when I first come out of surgery because I thought I couldn't breathe. Maybe I was almost like learning to breathe all over again, like I was just born. Because I had been going without breathing well for so long that I think it took me a couple of minutes, not long, but and I finally thought, okay, now I can breathe. Once I got past that fear right then, you're uncomfortable. You got these hoses on both, 4 on each side, so you're a little bit like an octopus when you come out of there. I sat up immediately, like as soon as I was in recovery. They had me sit up for a couple times for different things they had to do. So yeah, you're not, that you don't get to lay down long. They had me up that night walking in the hallway, so, and going to the bathroom. So there was a catheter, there was a tube put into my throat during surgery, in both lungs, but those came out before I even woke up, so I didn't have a sore throat. But I have heard from other people that had it done that they were hoarse for a while from the tube going in their throat. I didn't feel it, never had a sore throat, nothing. So I guess I was lucky there. I was on oxycodone. I was on, I had an epidural in my back. So there's a button to push, and I pushed that. I think you could push it every 8 seconds, and I probably did for 48 hours. I was sore, and then slowly I stayed. My hospital stay was 11 days, and most of that was to make sure that nothing. They X-ray you every day. They want to make sure there's no leakage in there. And so once that closes up, the tubes come out, and then so it was basically waiting for these tubes to come out, each one at a time. Once those are all out, I felt way better. I was in a different city, so it wasn't easy for me to just like go home. I stayed there the whole time. And when I got home, when I did get out, let me think if there's anything else in that little part before I go on to that. Yeah, I felt way better once they took the tubes out, those tubes coming out. When I went home, I did have my oxygen with me. I don't know that I really needed it. I mean, I would have needed it probably to walk very far, but I was off the oxygen, right away. That I was walking the hallways, a pretty big circle, right that same night, like I said. When I got home, I was up and down for a couple weeks. I had family. I had my sister and my friends and my kids. Everybody would come over and kind of check on me, and my husband made sure I kept walking. That, let me tell you, is the most important piece that I would want to tell anyone, is that they come in there and want you to blow in these tubes, and they didn't have to tell me. For whatever reason, I knew it, or someone had told me this, and it stuck in my mind, and I'm glad I did it, because I did it all the time. I constantly was exercising those lungs. I was blowing in this tube all the time. All day in the hospital, I was blowing on it. And, it hurts when you blow on it. You're like, it's a little bit painful, but I kept doing it over and over. And I think that's why I recovered so quickly. And because I know a lot of people don't. So you do the walking, do the breathing exercises. If they don't offer you one of those tubes, make sure you get one. The pierced lip breathing, those are all things you probably already know if you're at this point. When I got home, like I said, I was on oxycodone for a while. My biggest problems through the whole ordeal with this was probably, the constipation, the nausea. When you're on oxycodone and those kind of medicines for a while, your skin can start itching, and that happened to me. I was itching a lot. Other than that, those little irritations, those problems with the stomach, nausea, and that didn't last long. We're talking, 3-4 days, but it was enough to cause me to, it was a problem. Even after I got home, I still was dealing with these stomach problems and having to take fiber and, these fiber drinks and stuff. Those were my biggest problem, not to do with my lungs. So other than that, but like I said, it's been a couple years. I'm still doing good. My breathing is always, I push it. I walked a quarter mile yesterday and I should be walking a mile, but sometimes I slack off, and I notice, I got to keep with it. Do whatever you can. Swimming, singing, definitely singing is very good. Even if you suck at it, just do it. Just start singing, because it really helps exercise those lungs. So anyway, I'm wishing you all well, and I hope that whoever needs this, that they'll email me and let me know how they're doing. Thanks. Have a good day.